Hi, everyone. So my name's Tony Gill. I'm the forum lead for the Bioforum Development Group, and we're here to have this bio-digital fireside chat with Joon, Senior Director of Samsung Biologics. Joon, would you like to say hello and introduce yourself?
Hello, everyone. My name is Joon. It's a pleasure to have this opportunity to talk with a wide audience. Thank you, Tony, for this opportunity. Been with Samsung for about 6 years, predominantly in the drug substance project management. Recently, I transitioned into the sales role, so I'm serving as a senior director there. So I look forward to a very meaningful discussion on some of the trends and what we could foresee in the many years to come.
Many thanks, Joon. Pleasure to meet you. So we're going to be talking all about bringing speed to drug development from the CDMO perspective. So maybe Joon, in terms of overall trends, what do you see the latest trends in the industry as we've been managing the global pandemic?
Mm-hmm. Yeah, absolutely. I mean, the global pandemic definitely changed, everyone, not just in our industry, right? But specifically to our industry, I think the first trend that we could expect is the overall expansion, right? And I think predominantly this is driven by obviously the COVID, but also continuing increase in the demand for various therapeutic areas. So, even before COVID hit, there was a lot of focus on neurodegenerative areas, right? Alzheimer's and so forth. And the fact is, even after the COVID is managed, and we're seeing that worldwide, this need is not going anywhere, right? And as a matter of fact, may even be compounded. So I definitely foresee an expansion, continued expansion in our industry. And second is, there is a surge in major pharma players to lock in secondary or even tertiary manufacturing sites. And this is a response to really realizing how fragile our logistics could be, right? And there's always going to be an increase in expected patient needs. So the overall logistical nightmares, and this was not just in our industry, right? So definitely the way we are thinking about how we will manage the business robustness is really changing. So there will going to be a strong demand for more capacity. And this is applying for even many mature established players in the industry. So while I do not think in-house capabilities is going to go anywhere, many will still retain to have that control. Outsourcing will become pretty much a necessity. It's not going to be an option anymore. So, and of course, I feel that, as I pointed about the first option, the increase in the industry overall is going to be impacting this as well. And the third trend is the diversification and personalization of the services tailored to the specific needs of the client, right? And I really think this is driven by the various types of clients that we're seeing here, right? We have the big pharmas, the virtual startups, and anywhere in between. And different areas and different clients have different driving and motivating factors. And in the beginning of 2020, there was a flurry of effort, worldwide to get the COVID treatment or vaccine. And we're seeing the results of that now, about a year and a half since the propagation. But there's still a huge need here, a huge demand, and very many clients are being creative in how they're going to address this. So we definitely see a strong need to be customizing and making it a diverse and personalized service to meet the needs of the clients.
Very interesting, thank you. And what do you see as some of the challenges our industry is having, both from pre and post pandemic, and how do you think your organization can solve these problems? Maybe, for instance, why did your client contact Samsung Biologics, and how did Samsung Biologics solve it? What did they look for?
Right, absolutely. And just kind of continuing in what I had answered previously, the biggest challenge, I think, was logistics, right? Raw material sourcing, securing the capacity and so forth. So, I remember when the COVID hit us full force, right? Right around second quarter, third quarter last year, it was quite challenging, with the flights being shut down. We saw on the news some of the partners being hit with COVID cases, resulting in, plant shutdowns and, slowing down the production, impacting pretty much globally. So it really was a challenge in this area. So, while I do believe this will get better, and we are seeing that trend because, different sectors in the business become really adept to addressing this, as well as, the worldwide vaccination. But this definitely has been the challenge and really changed the way we look at our supply chain. And I definitely want to touch later on how Samsung Biologics has specifically managed it, but we've really been able to manage it because we had a preemptive planning already in place. Of course, we didn't know about the COVID and we didn't know the extent of the impact, but we always had in mind the business robustness of how we will deal with that. So having that planning preemptively really helped us. So equally challenging was the capacity, right? And I remember in early 2019 when Samsung Biologics had the vision to continually expand, right? We had just finished plan number 3. We're going ahead with approval planning and so forth, but we were already planning for plan number 4 and plan 5. But at the time it was just a blueprint, right? We were just getting ready for expansion. And similar to what I mentioned about the getting ready, the preemptive planning, right? Once the COVID hit, because we had this fortunate head start to expand, we were able to jump right in. And we're seeing all the different partners in the industry, different CDMOs, different partners are doing the same thing too, right? So personally, I think this is a great sign that we are expanding the overall size of the industry, right? It's a very healthy competition, but also, a sense of partnering with other players, because at the end of the day, it means we're providing more drugs to the patients. So how we were able to meet the capacity needs, because we already had these pieces in place to get ready for the expansion. We were really able to jump right in and meet the capacity demands of our clients. And of course, one of the biggest challenge I cannot not mention is just simply the way we do business, right? Right now we're having this Zoom conversation. I would love to meet you in person, Tony, and go for beer or go for dinner, right? But this is just how it is now, right? And who would have thought that Zoom stock would fly up like that, right? So, but specifically in our industry, where interactions with our partner is key, it really required us to be flexible, to be savvy, to build ability to connect with our clients remotely, all the while not sacrificing the quality of our work. So yeah, I think this is definitely a challenge that not just us, but everyone experienced. But specifically at Samsung Biologics, we stay very nimble. We employed live virtual tours and had very flexible ways of communicating with our clients. So staying connected even while we had this issue.
Excellent. I'll take you up on that offer of the beer when we can get back to traveling soon, hopefully. So aside from COVID vaccines and therapeutics, what do you think will be the most significant development in the industry in the coming years?
Yeah, so I feel that really the past 18 or so months has really witnessed a significant growth within the development and manufacturing of biologics, right? So aside from the COVID projects, we have seen advancements in new and innovative complex molecules such as ADC, bispecifics, multi-targeting, mRNA, cell gene therapy, and so forth. Good advancements, and the need for these modalities will continue to grow in terms of technology as well as the capacity for commercialization. So I've witnessed much more advanced pharmaceutical development activities in our clients in these areas. And the request has become, in respect to that, more complex and more demanding in terms of the customizability in the past couple of years. And I think this will definitely continue to grow. So, as a result, I expect the trend for increased need for sterile manufacturing capacity, as well as advanced formulation of final drug product in various complex therapeutic modality forms. And really the key here will be the focus on the route of administration, right? We have seen that in the past, such as self-administration, pre-filled syringes, cartridges for our disposable injectors. And I think these are the areas that will definitely continue to expand in the future. Absolutely. So, and if I could add actually one more point to that, I think in addition to this, because of these expansion and improvement in the processes, what I foresee will continue to grow is the decrease in the drug price generally. So, we see a lot of technology that optimizes like the yield and the efficiency in our manufacturing, as well as increasing the capacity. So, we definitely think that this will in turn translate into more value to our clients, and eventually that's going to turn into more value to the patients, right? And this is something that I feel it's overall it's a good trend, right? The fact that more medicine is becoming more accessible worldwide to many more patients, and Samsung Biologics definitely want to be a part of that.
Sounds absolutely very exciting. So in terms of impact of COVID, how do you see Samsung has fared during the COVID-19 experience, and what did Samsung Biologics do to mitigate against some of those issues that you perhaps experienced?
Absolutely. So, I did kind of touch there, talk about the logistics, but, as CDMO, what we experienced was, the raw material logistics issue is always quite challenging because, we're not only dealing with our own stock, but we also have to address to a wide range of, specific client demands and their respective raw material sourcing needs, as well as be sensitive to the market dynamics. So, we have our standard safety stock strategy, which is pretty much, industry standard, but, this really wasn't enough. So it was really good that even before the COVID hit, we had the plan in place to address this critical issue. And we had, two major kind of approach here. So the first one was establishing multi-sourcing, and the second one was to have an aggressive localization and building up local supply chain skill set. So in order to establish the multi-sourcing, we sought out to establish the route with different, sourcings from different countries that are in geographically separate regions. And of course, you can imagine this was to really reduce the risk as much as possible, so that whenever there is an issue in one side, we could readily switch to another. And in terms of building up the localization skill set, really involved working closely with not only our partners, but also the South Korean government. So, it really was a daunting task, right? So fortunately, now we have the Millipore Sigma Merck, as well as St. Gobain right next door, and we're able to enjoy that benefit of working together with those partners. And this was, possible, and because it was preceded by extensive internal assessment of our programs by, identifying any skewed dependencies on, single sourcing, assessing our reserve situations and any of the risks. So, I think having this plan up front really enabled us to stay nimble through the COVID pandemic. And, another critical area that we witnessed was the important need to have accelerated tech transfer and approval to meet the needs of the COVID patients. I mean, it's pretty much like a golden timing, right? We knew it was happening. We needed to reach the patients quickly. So clients worked very closely with us together on this. So personally, as a project manager, I don't like saying this, because, project managers, we die because of this. But we do have at Samsung Biologics multiple experiences in having out of freeze after tech transfer of mere 3 months gap. So 3 months from kickoff to, the OF, we only had 3 months, right? I mean, this was, from project manager perspective, a very impressive achievement. And of course, I have to add the fine print here, right? So obviously it involved working closely with the client, the raw material readiness within our network, as well as the clients. And, we even had clients flying out here, going through the quarantine, sometimes, working with the government to get the quarantine waived and so forth. So it was a daunting task. And, Samsung Biologics, because we're located in South Korean, work mentality is really hardworking, really dedicated, right? So, but we have to go beyond that, right? So, there is this joke, I don't know if you heard of it. So it's called Samsung Weekday, right? So Samsung Weekday is comprised of Monday, Tuesday, Wednesday, Thursday, Friday. So some of the people might not like me saying this, but of course, there's a lot of midnight oil burning, a lot of weekends. But at the end of the day, we're very happy because we're able to accomplish this major feat. And then even more impressive than this was that, from the kickoff to the emergency use authorization, it took us 6 months. So again, there's a lot of pride, and of course, hard work, right? No pain, no gain. So again, these are some good examples of where we stay nimble and address the COVID situation with our clients.
Incredible sense of pride coming through the back end of that, and achievement. So what are the greatest lessons learned from the global pandemic? What would be, or how would this impact the next 5 years, do you think?
Yeah. So, and I really, the biggest, as I mentioned, would be the way we work, I think. And, everything has to be remote, right? The partnership with our clients, person and plan, how do we manage that? Regulatory agency interactions and so forth. So it was really funny that, even before the COVID, we already had these technologies, right? Like the Zoom, the virtual interactions. But I don't think everyone was using it to the fullest extent. The utilization and the proliferation was still very limited. It was only limited to maybe some of the early adapters, right? But now it's ubiquitous. It's all over the world, and you really can't work without it, right? So I feel that is definitely a trend that we're going to see, and it's definitely lessons learned that we have to be very open-minded in how we work, right? And even after the COVID is managed, I'm not sure if we're going to be able to go 100% back to the way things were, right? Regardless of the different opinions. So I think this is definitely an area we should take as a lesson learned. And even after it's managed, we have to be very flexible in this aspect. And another, and this is sort of a personal, I feel like it's a win for the entire world, is a sense of partnership. And what I mean by that is, once the COVID hit, it was really the whole globe uniting on a single front to fight against this, right? And it was really unprecedented, and people working together, government agencies working together to pass the competition, pass the differences. So I feel that this was definitely a win in that area. And we have many players in the CDMO, right? Not just us. There are major players, but I do consider that they're all partners. There is a healthy sense of competition. Yes, that's not going to go away. But at the end of the day, we're all working together to meet the needs of the patient. So I really appreciate the sense of partnership that at least people in this industry were able to coalesce behind. So I think that's definitely lessons learned. That at the end of the day, it's not just about dollars and cents. It is about impacting the lives of the patients and this very real, impactful global pandemic.
Wonderful. So maybe moving on to CDMO trends. What are the core demands from your clients at an early stage of commitment?
Mm-hmm. So, when we were engaging with our clients in the very beginning part of the engagements, they ask a lot of questions, right? RFPs, there's a lot of RFQs going back and forth. And some of the major questions that they ask, obviously, is going to be the quality of service, right? And the expertise and the experience behind that quality of service. So that's going to be the one major area. Excuse me. And kind of reflection of that will be the regulatory track record. How many agencies, how many approvals do you have under your belt? If you have any 483s, that kind of a thing. So that's definitely the starting point of assessing and demanding from our clients. And then what we're seeing, and I did mention it briefly, is the need for flexibility. But at the same time, there's a dichotomy here, because what the client is asking for is to have a robust platform with the CDMOs. So they're asking for a platform with which they could apply their process. So really, what they're asking for is to have the platform with the flexibility to customize to meet the client's specific needs, right? So at Samsung Biologics, we have our proprietary cell line, the S Choice. I do like the name, S and the choice. I didn't come up with the name, but I thought that was so. We're building up the track record, and we're very near the IND for this one as well. So having the cell line and then adding the flexibility to customize based on the client's need is very important. And also, just to let you guys know, we are coming up with the Samsung Process Platform, which we'll be rolling out in July. We haven't determined the name yet. I do have some ideas, so. Let's see how catchy that will be. So again, going back to the point, obviously having that platform with the flexibility is definitely a strong demand that our clients are looking for. And then another very major area is the capacity with the flexibility here as well. So obviously entering through partnership, the client is expected to commit to a certain volume. And then the CDMO obviously is expected to guarantee the OTI at the on-time and full commitment, right? And I think this is absolutely critical. So, and this is one area where I think Samsung Biologics has definitely been very good in terms of meeting the client. And I do want to add that this is not just about the large scale, the 5K, 10, 15, 20, and beyond, but this is also about the cell line development and the process development arena as well. So. Yeah, and of course, I think one area, actually one thing I want to add here is, in terms of expertise, is that at the end of the day, the client doesn't want to spend a lot of time teaching their process to the SME, right? They want to leverage the expertise that we already have. So that's definitely one area that they try to kind of push. And last but definitely not least, pricing is definitely a factor, right? And we do understand that the pricing has to be very competitive and it has to be equitably, commensurate to the level of service that we're providing. So, yep.
Excellent. So in terms of technology, what bioprocessing technology do you foresee leading the industry over the coming decade, both in terms of real approvals and just general impact overall?
So over the next decade, we do expect seeing strong interest in improved manufacturability of drugs, like continuous manufacturing as a way to reduce costs, speed the scale of process, increase the quality, reliability of the end drug, and so forth. So many are seeing increased optimization already and the cost savings as a result of continuous processing. So over the last few years, what we've seen was the continuous manufacturing has moved out of the preclinical and clinical manufacturing to include full-scale production, both in the DS and the DP manufacturing. And the benefits that we're able to enjoy are obviously decrease in the production cost, increased efficiency in the equipment utilization, reduction in end-to-end batch time, up to maybe 80%, it takes less time for us to do it. So, plant utilization from the CDMO, CMO perspective, very important. And then, optimizing our inventory and utility management. So, reducing the overall cost in that area as well, right? So actually, most companies are already applying the continuous processes in the upstream, N-1 perfusion and so forth, right? So within 10 years, such efforts are expected to drive, reactor productivities from, 1 grams per liter per day to maybe even tenfold, 10 grams per liter per day, right? And not only that, we foresee that it's not going to be limited to just the upstream, but it's going to be, translated to the downstream as well, right? Enabled by, new improved alternatives to traditional chromatography technologies. So, for the next decade, trend will be to unlock the aseptic downstream processing at a large scale and eventually operate continuous manufacturing at the full scope, pretty much the holistic approach.
Excellent. So maybe looking forward, what new paradigms do you think you will see having the greatest impact next year?
Yeah, so I strongly believe that the digitalization will drive the pharma sector in the next decade, right? So, one thing I want to add is, in general, compared with other industries, the pharma industry is resistant to change. They're very concerned, right? And when the COVID hit, it's kind of funny to see all the players kind of scrambling to get this going. And so this might be a little bit TMI, and this is a good analogy. So I recently had a health checkup, and my LDL was like 200, which is very surprising. I was shocked because I'm a carnivore. I love eating meat, right? And I hate changing my diet, right? I know I'm supposed to, but it wasn't until I got the red flag that I started to change. And it's the same thing with the pharma industry, right? We know that the digitalization is coming. We know that there's benchmarking already available in another industry, but we never really got into that because we're, for whatever reason, right? Because there's a lot of, costs involved, there's a lot of risks involved. But now that we have experienced this pandemic, and I feel that many of the players, including ourselves, has recognized that digitalization is something that we need to jump into, right? So, I feel like the industry has definitely started implementing, within the company's operations, in their communications, day-to-day, activities, and collaborations, right? So, and we see this in various areas, right? So, one area that we're currently working on with our capabilities, and we have seen is real-time, cGMP data sharing with their clients, so they could track the status of their manufacturing data in real time, anywhere, just using their smartphone or whatever it is. And another area is artificial intelligence and machines and technologies that allows us to efficiently analyze, predict, and even prevent deviations or any incidents in the future. So I think those are two major areas that we are going to see in terms of the trend in the digitalization. And, we're also seeing a strong interest in improved manufacturability of drugs, right? I did mention about the continuous manufacturing. So these will all end up in the benefit of, reducing the cost, speeding up the scale of process, and, overall increasing the quality and reliability of the end drug, right? So, at Samsung Biologics, we already employed, live virtual tours, having virtual audits, from the regulatory, agencies, remote inspections. So these technologies, at the end of the day, it's not going to completely replace the human-to-human interaction, and I get that. But at the same time, we will have this flexibility to ensure that we're able to work remotely safely at the same time, not sacrificing the quality of work.
Wonderful. So perhaps getting close to the last couple of questions then, Joon. What factors do you see to a successful partnership? What advice can you give to our audience to create this environment for a successful partnership?
Yep. So I think this message is for clients as well as CDMOs, right? And I think the CDMOs could probably relate to what I say here, but also the clients as well, right? Because at the end of the day, this partnership needs to be successful, and what are some of the factors? So I could come up with three major areas. So first would be trust stemming from transparency. Second is alignment of expectations. And the third will be the flexibility to meet each other. So, I want to start with the trust, right? So in any kind of relationship, you have to build trust from the get-go, right? But where does trust come from, right? It comes from communication, but more specifically, transparent communication. So sometimes I know that there are different cultural backgrounds that may hinder in this area, but at the end of the day, if we are entering into a partnership that aims for success, there has to be a very transparent communication and understanding that, okay, this is the plan up front, how can we help you? And kind of continuing with that principle is the alignment, because once the trust is established, we're not just building trust for the sake of building trust. We're here to work together for a common goal. So it's very critical that we align in terms of the expectations of the goal and the different processes that we're going to take to reach that goal together. And the third, the flexibility is really required, because inevitably in our journey together as partners for a common goal, there's going to be some disagreements and some discussions on how to take to the next step. And this is where the flexibility is very critical. So as a CDMO, of course, at the end of the day, Samsung Biologics has as a principle that we're always going to be flexible to meet the needs of the client. But at the same time, it goes both ways, that the client has to understand certain ways that that the CDMO has been working to a wonderful degree. There has to be a trust and the ability to trust into the expertise of the CDMO. So I think that those three factors, starting with the trust, going with the alignment, and then having the flexibility to mitigate any future conflict are the keys to successful partnership.
Oh, brilliant. And finally, what do you see differentiates SBL from competitors?
Right. So this is the pitching moment, right?
Absolutely.
Yeah. I think this was great conversation, and I did hint at some of the areas where we are aiming and succeeding in terms of differentiating from our competitors. And I do want to say that I don't want to end with just the term competitors. These are partners, right? We're all working with major players in this industry together. But I do want to mention, okay, I'll go with three again. So the first I can mention is the speed complemented by quality. Second is multifaceted flexibility. And the third, and probably the closer to my heart, is the patient-centric culture. So at Samsung, we pride in our speed of working to accelerate clients' product to market and eventually to patients in record time. So our development program has a standard timeline of 14 months, which can further be accelerated to 9 months, from vector construction to IND, for example, right? And I did mention about the 3-month tech transfer under certain conditions. So, these are areas where we are very excited in terms of our track record to provide speed of service while not compromising the quality. So in the second area, the multifaceted flexibility, we understand because different clients have different needs. So, our principle is to tailor our approach specifically to meet the needs of the clients, where they are, when they are, how they are. This is like a church retreat. Just come as you are, and we'll take care of the rest, right? So, and the whole principle here is to provide a comprehensive end-to-end experience customized to you, right? So, we can do this because we have, quality people in our organization, with the expertise and the experience. We have project managers, quality center, supply chain, regulatory, all work together to meet the clients where they are. In addition to that, because Samsung Biologics is part of the grander Samsung conglomerate, we have the financial robustness with which we can have the flexibility in the financial area. So, what this enables us to do is to have explosive driving force in making huge decisions. We talked about huge facilities, equipments. These major decisions, we're able to have that flexibility because we have that strong foundation. And not only that, we're also able to foresee and set the trend for future market. So and these are some of the areas that are many of our partners definitely not are able to enjoy to the same degree. And the final one is regarding our culture. So in 2021, Samsung Biologics hit a milestone. So we are now 10 years old, right? So it's if I look back, it's quite amazing what we have accomplished in the short period of 10 years. But what I'm most proud of is our culture. So we are a patient-centric and very energetic organizations, and it gets me every time when I watch the patient testimonials of the products. And I personally ask our clients whenever we've gone through certain milestones and we've hit that commercialization, and they're able to, because they have their own client testimonials as well. Can you please share that with us? And we share this internally all throughout the company, because at the end of the day, right, the prepping the media, packing the column, the endless TCs and the Zoom meetings, the endless cycles of doc and review, the SIPs, CIPs, all the daily activities that we do makes a difference to someone's life, right? So, and that's the principle that we have, that every minutia of detail in terms of our daily work is impacting the lives of patients. So we definitely approach it with that value in mind. So, our motto is we are driven for life. So I know it sounds a little bit kooky, and I was a little bit hesitant as well, but it's true, right? And we have that culture emanating from top to bottom and so forth. So we're very much very, very proud of that.
Wonderful. Well, it's been a pleasure speaking to you, Joon. Thanks very much for your time. Thanks very much for your insights into a fascinating world at Samsung Biologics. So thank you. Nice to meet you.
Yeah, Tony, thank you so much. And yeah, like we said, one of these days we're going to hit one of the bars, right?
Sounds good. Sounds good.
Well, thank you so much, Tony.
Take care. Bye-bye.